Hey, Dr. Derek Nielsen, owner and founder of Kaizen Physical Therapy. Today I want to talk about 2 secrets about surgery that your doctor is not telling you. But first, my lawyer makes me say this. This is not individualized recommendations. This is kind of overarching themes. This is what science tells us and personal experience here. So if you're in pain, you're looking for a solution, make sure you seek out the guidance of a healthcare practitioner for yourself. Okay, so the secret number 1 is misdiagnosed, however you spell that. Misdiagnosed. A lot of people are misdiagnosed. So you saw in the first video with referral pain, joint by joint approach, what feels like pain somewhere really isn't the reason for pain. It's coming from somewhere else. Then you saw with x-rays and MRIs, people that have no pain have the same findings on an x-ray and MRI as the people that do have pain. So what came first? You have to question what came first, the results on that x-ray or MRI or the pain? You don't really know. So we want to assume that what's shown as an abnormality on the x-ray or MRI is the reason that someone's in pain. But as you saw, a lot of people that have no pain have those same findings. So a lot of people are misdiagnosed as this is what's going on, this is why you're in pain, and you need surgery. And then they undergo unnecessary surgery. I will say this, that surgery is, it's definitely necessary at times. I'm not advocating for somebody not to have surgery if it's necessary. So say like a tumor or a foot drop or cancer or something that's immediate need, like I talked about before. This isn't a video saying all surgery is bad. This is a video saying a lot of unnecessary surgery is going on, and this is one of the secrets. Is there just makes people are misdiagnosed as saying this is why you're in pain, you need surgery to fix it, and then they're still in pain after. I do see a lot of people in the clinic that have undergone surgery and they come out and they just don't have the relief that they wanted, or they're in worse pain. Surgery can have 3 different outcomes. It can be positive, it can do nothing, and then it can also be negative. So that's something that people don't think about is they want to go in there, they're looking for a solution, but then they come out worse. So that's what my patients want, is they don't want to go in for unnecessary surgery. They want to make sure that they've gone down every avenue to make sure that they can't get out of pain and feeling better before they opt for surgery. So secret number 2 is Moneymaker. I debated putting this in because I don't want to talk down or bad on a system, but I think people need to know this, is that intervention which is reimbursed is the intervention that's provided. So when insurance companies come out and say, hey, we're going to pay for this, but we're not going to pay for this, the chances of you getting something that's not paid for, you're not going to get. You're going to get that which is paid for, and that which is paid for at the highest dollar amount, you have a higher chance of getting. So surgery is paid for at one of the highest ones, so that's the intervention that is, often said, hey, let's do this. And pain meds and injections are paid pretty highly as well, and so they're driven towards that. But if insurance came out tomorrow and said, hey, we're not going to pay for injections anymore, they'd stop offering them. Nobody would say, hey, I think an injection would work for you. No, they wouldn't say that. They'd say, okay, let's try this. That's what is paid for. So it really comes down to the intervention that's paid for is the intervention that's given. Whether that's beneficial or not, it's something to consider. So again, I really debated putting this in here because I don't want to talk down on a system. There's a lot of good things that happen, but it's something to consider. Think about that as going forward, is that which is paid for is that which is given. Hopefully that makes sense. Okay, thanks for sticking along with me here. Again, if you have any questions about anything that I'm talking about, please hit reply to this email. And let me know, because I will come out with another video, and if you have a question about it, I'm sure somebody else does as well. I'll talk to you tomorrow. Thanks so much for listening.